everyone, this is Dr. Tatum. Today we're going to talk about Chapter 8, which is Maternal and Fetal Nutrition. So if you'd like to take out your PowerPoint slides and follow along, we're going to start on slide 2. I also think it would be important to have your textbook available just because I will be referring to a few page numbers throughout your chapter that will be a good reference for you as you start reviewing some of this information. So slide 2 really emphasizes the importance of good nutrition. So good nutrition that is rich in protein, in whole grains, fruits, vegetables, milk products would be essential and optimal for fetal growth and development. If a woman is not getting great nutritional intake, then we worry about low birth weight infants and also premature deliveries. So low birth weight infants are infants born that weigh less than 2,500 grams, which is about 5.5 pounds. And premature infants are those infants that are born before 37 weeks gestation. And oftentimes these infants also have very low birth weights. You can see some staggering statistics on the last 2 bullets of this slide. Neonatal death rates for near-term babies is 3 times higher than for term babies. And the 2% of infants born very preterm account for 50% of infant deaths in the US, which is pretty alarming. Let's move on and we'll talk about slide 4. So first trimester is very, very important for embryonic and fetal organ development. So this is the time where all the baby's small organs are developing. So the first 13 weeks of pregnancy is when really this occurs. So there's lots of development going on. It should be emphasized that during this period, the mother should really abstain from any illegal drugs, alcohol. If she is a smoker, she needs to stop smoking because all of those things can interfere with organ development. We should also make note that if she is taking any prescribed medications or even over-the-counter medications, she should double check with her doctor to make sure it is safe for her to be consuming or ingesting those medications, because there are certain medications that can cause teratogenic effects in the baby. And so just making note that she should contact her doctor right away once she finds out that she is pregnant and to know what is safest for her to take. Folic acid is also a critical nutrient that is important before pregnancy if possible. So if she has adequate amounts of folic acid in her diet prior to pregnancy, that is great because oftentimes that folic acid aids in the growth and development of the brain and also the spinal cord. It also aids in making blood during pregnancy. And so we always tell her that she should take a prenatal vitamin right away as soon as she knows that she is pregnant. But if she is trying to conceive, she should also be taking a prenatal vitamin because those prenatal vitamins have adequate amounts of folic acid in them. We recommend about 600 micrograms of folic acid daily during pregnancy. It's important because adequate folic acid in her diet will help decrease the chances of any neural tube defects in that first trimester. And if there is a neural tube defect, oftentimes it will lead to spina bifida. Let's move on and we'll talk about weight gain. So weight gain during pregnancy is very important for the development and growth of the baby, the placenta, the amniotic fluid, the uterus, as well as the breast. It also helps with blood supply and fat stores during pregnancy. A woman that has an adequate BMI, so a normal BMI value, only needs to consume about 300 extra calories per day. Now, if she is starting to diet or she's really alarmed by the amount of weight gain that is occurring, she might start to restrict some of her nutrients in her diet. And we don't want that to happen. If she starts to restrict adequate nutrients and doesn't allow herself to gain appropriate weight, then we worry about intrauterine growth restriction, and that's what IUGR stands for, intrauterine growth restriction. And this results in very low birth weight babies. Protein is essential for the growth of tissue, for the expansion of red blood cells, and also for lactation during pregnancy. So foods that are high in protein should be consumed at least 2 to 3 times a day. And we recommend low-fat meats like fish, chicken, eggs, beans, and also milk products are going to be good sources of protein. We also want her to drink lots of fluids. So 3 liters of fluid is actually recommended per day. So we want her to drink water, milk, and juice. That's going to help expand her blood volume. It's going to help aid in the excretion of waste products and also with lactation as well. So moving on, we're going to talk about the BMIs and recommended weight gain during pregnancy. So you can see here on this slide that a BMI that is less than 18.5 is considered underweight or low. And these women need to gain about 28 to 40 pounds during pregnancy. A BMI that is of 18.5 to 24.9 is considered normal, and these women should gain 25 to 35 pounds during pregnancy. A BMI of 25 to 29.9 is considered overweight or high, and these women should only gain about 15 to 25 pounds during pregnancy. And a BMI that is 30 is considered obese, and these women should only gain 11 to 20 pounds during pregnancy. So moving on to some of the recommended minerals and vitamins. Iron is going to be essential for maternal hemoglobin formation, and also it aids in fetal liver iron storage. And so iron intake is usually increased during pregnancy to allow the transfer of iron to the fetus. And it also aids in the expansion of the patient's blood cell volume. And so iron is critical. We want her to have at least 30 milligrams of iron daily in her diet. Oftentimes, prenatal vitamins will contain iron, but iron can be harder to digest in some women, especially if they suffer from morning sickness. If that nausea is really severe during that first trimester, sometimes iron can make that worse. And so we tell her to take iron on an empty stomach because it's going to be absorbed the best on an empty stomach. But she could try taking that iron at nighttime before bed, and that might help decrease that nausea that she is experiencing. Also, we know that a diet that is rich in vitamin C is also going to help absorb iron the best. Just make note that iron can cause constipation in some women, and also iron can lead to black, tarry stools as well. So make sure she knows the side effects or adverse effects of iron. Calcium is essential for building up the baby's bones and teeth, and it also maintains maternal bone mass. And so, calcium intake of at least 1,000 milligrams is important daily as well. Other minerals and electrolytes would be magnesium. Magnesium is important for energy as well as protein metabolism. It also aids in tissue growth. And so diets that are rich in whole grains and meats as well as nuts would be essential for magnesium. Sodium is going to really help maintain water balance. A lot of times, sodium intake is recommended to increase just a little bit during pregnancy because of all the extra blood volume on board. There's usually no sodium restriction, but we do want her to watch the amount of sodium that she is ingesting. We don't want it to be too much because we know that too much can lead to more edema. Mild edema is pretty common during pregnancy, and usually is considered fairly normal, but just make sure that she understands that too. Potassium is going to help reduce hypertension. So adequate potassium, at least 8 to 10 servings of potassium a day is important. So that would be in the form of unprocessed fruits and vegetables. Also, moderate amounts of meat and dairy products are going to contain adequate potassium intake. Zinc is going to be very important in metabolism as well. It's also going to help prevent congenital malformations if she has appropriate amounts of zinc in her diet. And then fluoride, usually there's no supplements that are recommended for this. There's no evidence that suggests that pregnant women need more fluoride in their diet. So if she asks, that's what you can tell her. Moving on, fat-soluble vitamins are stored in body tissues. So those would be vitamins A, D, E, and K. Usually women of childbearing age lack adequate amounts of vitamin E in their diet, but also they too have a very low intake of vitamins A and D in their diet. So what is recommended is that they should have adequate amounts of these fat-soluble vitamins. However, chronic overuse of these vitamins can result in toxicity. So really, we tell her to not take any supplements of these fat-soluble vitamins unless prescribed by her doctor. Water-soluble vitamins would be folate or folic acid, and as we talked about before, a recommended 600 micrograms of folic acid is really key. And folic acid is also going to be found in the forms of enriched grain products like white bread, flour, pasta, and fortified cereals. Pyroxidine is important in protein metabolism. However, there is no supplement recommended for pyroxidine. And then vitamin C will aid in wound healing. It also helps develop the baby's teeth and bones. And as I said before, it enhances the absorption of iron in her diet. So vitamin C is also really important. As I talked about before, multivitamins, so in the form of prenatals, like a prenatal vitamin is important, and making sure that she is taking that daily will also help. All right, moving on. One word that I really wanted to point out to you is called pica. Pica is interesting because this is when a woman will consume non-food substances. And these non-food substances might be in the form of ice, clay, wax, toothpaste, soap, coffee grounds, laundry detergent, baby powder, chalk. So all of these unusual substances are things that she actually craves. And what could be is that if she's craving these food substances, she might have a nutrient deficiency in either iron or calcium. And so it's so important to have her notify her doctor if she's having these unusual cravings. I do want to point out on page 256 of your textbook, there's a table that goes through, it's table 8-4, that talks about just physical assessment of nutritional status of the pregnant lady, but also signs and symptoms of poor nutrition. And I would really like you guys to look at the signs and symptoms of poor nutrition because that can be pretty alarming. So when you do your assessment of a patient, look for those signs and symptoms of poor nutrition. Moving on to slide 10, physical activity during pregnancy. So exercise is still very much recommended, usually about 30 minutes of moderate exercise daily if possible. If she does have an underlying medical or obstetric issue, then she really needs to talk with her doctor about that. But again, if she is healthy and her pregnancy is relatively healthy, then really exercise is still okay. It's still recommended for her. Moving on to nutrient needs during lactation. So nutrient needs during lactation is similar to that of pregnancy. Basically, these needs are based on the amount of nutrients released in breast milk and also needed for maternal tissue maintenance. So these energy needs include protein, calcium, iodine, zinc, the B vitamins, and vitamin C. You can see here that energy intake is increased by 330 kilocalories or more. And also smoking, alcohol, and excessive caffeine intake should be avoided during lactation. So very similar to pregnancy. One thing I wanted to point out too is during lactation, she really needs to maintain hydration. So again, making sure she is drinking lots of fluid throughout the day, but also having a healthy intake of fiber in her diet as well. So about 28 grams of fiber is recommended per day during lactation. All right. Other things as far as adequate dietary intake. A few things I wanted to point out on this slide would be the nausea and the vomiting. So if her nausea and her vomiting is very extreme, she should be given antiemetics to help with some of that morning sickness. Vitamin B6 might be essential to help reduce or combat that nausea. And also the acupressure P6 points might be very beneficial for her too, like those C bands that we talked about.